Hi, everyone. Welcome to Sign's Ask a Neurologist podcast series. My name is Audrey Huang, and I am a second-year medical student at New York Medical College. Today, I have the pleasure of interviewing Dr. Tracey Milligan, who currently holds the position of Chair of the Department of Neurology at New York Medical College and also serves as the Director of Neurology at Westchester Medical Center Health Network. Dr. Milligan, thank you so much for joining us today.
Oh, it's my pleasure to be here, Audrey.
All right, so let's get right into it. Can you tell us a little bit about yourself and your journey to becoming a physician?
I'd be happy to. So my journey to becoming a physician, I decided that I was interested in becoming a physician when I was in high school based on TV programs. I didn't have any, experience in medicine. I had a family member who was ill, but I didn't have any people in my family who were physicians that where I had exposure to that. But in college, I deviated from pre-med, and instead I went into graduate school for speech language pathology, and I worked as a speech language pathologist for several years, working with people who had strokes and traumatic brain injuries, and I enjoyed that work, but it wasn't exactly what I wanted to do. And one of the things that helped me realize that is on the weekend, I would be free. Right. So students, you aspire to this, right? Someday you will not have to work on the weekends, maybe. And so it was great in that way, a very predictable, sort of 9 to 5 job, weekends free, no work at nights, all these things that I really worried about, what a career in medicine would be like. And I didn't have to worry about any of that. But my husband, who was a computer engineer, at night and on weekends, he would be constantly like reading about computers or working on computers or talking about computers. And I didn't want to do that in my profession. I was like, work is work and home is home. But then I thought, actually, what I do want is I want a job where I do enjoy reading about things that are related to my job at nights and on weekends. And I worked with neurologists and my job as a speech language pathologist, and I worked with medical students. And I thought, you know what? I think that is actually what I want to do, even though it means sacrificing nights and weekends and working really hard and not having that really easy lifestyle. So I think for me, part of the journey was to experience something I thought maybe I wanted and prioritized, and then to find that it really wasn't what was going to be most meaningful to me. And so with a lot of support from my husband, he got an honorary degree as a med student too from my medical school. It was he sacrificed a lot as well, but I couldn't be happier with my decision. 100%. I'm so glad, and I do have exactly what I wanted. I have a job that I really enjoy, and I enjoy it so much that on nights and weekends, I do enjoy learning more about the brain and things that pertain to patient care. And so I find that really rewarding.
That's so wonderful. Thank you for sharing. So why did you end up choosing neurology as a specialty? And along the way, were there any other specialties that you considered?
So one of the reasons I chose neurology, I think, ties back to the story I just told. So in medical school, I went into medical school with a totally open mind because my best friend in medical school, she said, "You were the happiest person on orientation day I could ever imagine." I was like so happy. I was finally in med school. And for anybody listening to this who has worked full time before med school, it is a joy to have nothing to worry about and studying and learning, because there is a lot of other kinds of stresses that come into working full time. And I was able to be a full-time student. I had that luxury of being able to totally devote myself to the studies. So I went in, I loved medical school, and I had an open mind. I went into every rotation saying, maybe I want to do this. What would it feel like to go into pediatrics or surgery or OB-GYN? Every single rotation. So I approached it that way. And so at when you have to decide in medical school, I looked at the things I was most interested in and wanting to continue doing, but I had that priority of really continuing to be interested in it. That I did not want to go into a field and master it and then have, just do the same thing every day and be increasingly good at it, more efficient in the same thing every day. I wanted to be in a field that I would find fascinating for life. And so in making that decision, I said, you know what? For 10 years, I've been really interested in the brain. And I think I will be good for at least another 10 years. And now, over 20 years into my career as a neurologist, it remains the same. I love what I do. And I made that choice and prioritizing my specialty based on wanting to continue to have that lifelong interest in it, to continue to be fascinated by what I'm doing, and to have the ability to help patients in a really meaningful way to me. So it was a great decision, and that's some of the I would say some of the shorter story of how I made the decision. The other things that I thought very seriously about were internal medicine and psychiatry. And in internal medicine, I decided there's a lot of areas of internal medicine that I also find fascinating, but not 100%. So as a neurologist, I can pick those areas and continue to practice and help my patients in those areas without being responsible for, the entirety of internal medicine. And then in psychiatry, it is fascinating, but I liked a little bit more of the concrete nature of neurology. So, there are in neurology, you have diseases where there are discrete lesions that we can identify. And there's so much overlap between neurology and psychiatry. It's one of the areas that I really enjoy in neurology.
Thank you. So to go off of that you are also within neurology an expert in epilepsy. How did you develop an interest in that field?
So this is a lesson, I guess, in going into training and being sure about something. And I'm sure that a lot of people listening to this went into med school being pretty sure they wanted to do something and then deciding on something else. Because we know in those people who go into medical school and they are sure they're going to do this, 50% of them do something else. Sort of flip of the coin, whether you stick to what you thought you were going to do or not. And so when I started neurology residency, I also had a pretty open mind. I had a few areas that I was most interested in stroke and behavioral neurology, because I had the most exposure to those pre-medical school. But I was very open-minded. And somebody asked me when I was in my first year of neurology residency, what do you want to do? And I said, I don't really know, but not epilepsy. So then why did I choose epilepsy? Well, I learned a lot more about it. And so part of the reason I answered the question in the way I did was that I was just ignorant about the field. And so some of the reasons I chose epilepsy is it really allows for working with people of all ages, all demographics, and it is very tied into psychiatry. There are a lot of medications we can use. So I always like pharmacology and really being an expert in the medications, the pharmacokinetics, pharmacodynamics, side effects, management of that. It has surgery that we're involved in. So just a little bit of surgery, but not too much. And there's EEG. So talk about, trying to find a concrete part of what I'm doing and the more nebulous part of it. It's frequency and amplitude and voltage and all of that. And then you become an expert in interpreting that and using that diagnostic tool to help directly with your patient care. So there were so many things about it that all came together. And still, I found myself as an epilepsy fellow. Somebody said, oh, how's fellowship going? I said, the more I learn about it, the more I like it. So, but it has been a very rewarding subspecialty because it does, epilepsy affects so many people worldwide, and a lot of ways to actually help people come from having an expert knowledge base in this. And so some of the ways that I can help people stop seizures have to do with just the fact that I've become an expert in this area and can help them decide on the treatments that are going to work the best.
Is there any condition or conditions that you see and treat more often?
So epilepsy is the field that I specialize in. So people who have seizures or suspected seizures. But because my other focus has been on medical education, I've always maintained a very broad and comprehensive outpatient practice. And so I see patients, with other neurologic problems. Part of my career has always been, volunteering in underserved areas. So I spent a number of years in Shiprock, New Mexico, in the Navajo Nation, volunteering there. And then I also worked in nursing homes and provided neurologic care there. And so, I would say, I enjoy the field as a whole.
So I know you were very involved in medical education. Could you share how you initially developed an interest in this area?
So for people who are thinking about going into neurology, I bet all of you are interested in medical education. Every single one of you. That has been my experience, that people who go into neurology, I don't know if it's something about we like to think about the brain, we like to think about other people's brains, we like to teach them about it and think about how we're teaching and learning. I think there's a lot of shared interests in the field of neurology and in medical education. And so I always had that interest, but I also had interest in education outside of neurology. And so I had spent some time doing some different volunteer work in education with students of all different levels. But it was as a resident that I became involved in teaching medical students. And so I think it was my interest as well as the opportunities to do that. And I started teaching how to do the neurologic exam as a resident, and I started teaching neuroanatomy as a resident. And those are activities that I've just continued to do throughout my career. So I think, you can tell that I love what I do. And so part of that is really teaching other people about it. When it comes to neurology, it's pretty easy to be a teacher because the subject matter on its own is fascinating. And so if you're teaching about neurology and somebody does not find it interesting, I mean, that's totally on you, because it's like, who is not interested in this, right? We all are fascinated by our own selves and how we're thinking and why other people are behaving in certain ways. And the consequences of neurologic disease are so devastating. So I think the subject matter is interesting. And then it takes that certain focus on really being interested in helping people who have neurologic disease. Now, that is not for everyone. People can be interested in the topic and find that their focus in medicine is another aspect of helping people with different types of diseases or prevent different types of diseases. In neurology, one of the things that I really enjoy about taking care of the patients is that the diseases themselves really hit at the core of who we are. And so finding it really rewarding to help others. People with neurologic symptoms and diseases really do need a lot of help. And there is an increasing number of treatments that we can offer. But also because the diseases hit at who we are as individuals, every single time it's something new. So it's not the exact same problem because every person is different. And so that's part of kind of that lifelong finding things fascinating, interesting, and learning. I wanted a field where I would always be learning as part of it, where the learning would never be done. And neurology is definitely that. And it's been so exciting to see all the advances within the field as well.
That's amazing. Now N equals one, but as someone who is interested in neurology, I am also interested in medical education. So you got that part exactly right. So to shift gears a little bit, could you describe a typical week or day in your life?
So one of the things I looked for in where I practiced as a neurologist is I wanted to have variety in my day. So I'll tell you about my day, but I have designed my career to have flexibility and variety. And there are so many different ways to have a week structured as a neurologist, including how much you work. So, every neurologist will have a different take on this. So I don't think you should go into the field because you like a certain structure, because there's so many opportunities after you're done with training to have this structure that really fits with what you're looking for in your career. So for me, I wanted variety. I did not want every single day of the week to be the same. And so I've always had a variety of working on the inpatient service. And working as an inpatient neurologist, the days are longer and they often involve weekends, and you're seeing patients who are sick in the hospital with acute disease and working with a whole team structure. Those have been so. I would say it's always through my career, it's been about 12 to 20 weeks that I will be in the inpatient. And so for the medical students, you know what that is like. You see your attendings on the inpatient service quite a bit. On the outpatient weeks, I typically will have a few half days of outpatient clinic that I see patients. Currently, it's 2 half days. I spend a half a day doing virtual visits on telemedicine, and then a half a day in-person clinic. And then once a month, I do half a day of resident clinic. And in the outpatient, I have a new patient every hour, a follow-up patient every half hour. And, it's just a different pace. And then after the clinic, I spend my time, doing my notes that go along with the clinic visits. And as an epileptologist, I spend time reading EEGs. So that could be a half a day a week that I'm reading EEGs, a full day a week. We also have an inpatient epilepsy monitoring unit. So that will be caring for the patients who come into the hospital with epilepsy or suspected epilepsy. And we remove the medications, we record the seizures, we make the diagnosis, determine whether they need surgery or not. And now in my current role, I have a lot of administrative time. So I get to do fun things like be interviewed for podcasts and have meetings and try to help facilitate, better education for people and better clinical services for our patients and career development for the faculty and the residents that I work with.
Sounds like you have an incredible variety in both your work and life. So to kind of jump off of that, burnout, as you know, is a very prevalent topic in medicine. And can you share some strategies that you've maybe developed over the years to prevent that from happening and maintaining a healthy work-life balance?
Yeah, I think that's such a great question for you to pose to the people you're interviewing. Because for people in training, I think one of the most important things is to recognize when you're approaching burnout. And I don't know, honestly, I don't know any neurologist or any, physician where they haven't experienced at least approaching that or aspects of it, or just, being really, really tired. And things are harder when you're tired. So to have that own internal barometer and to learn that, and I've definitely learned that over time. And so to know when I'm approaching that, and for me, it's also, it tends to be somewhat seasonal. So at one point I said to my husband, I said, okay, February, we're going someplace with sun, with long days and lots of sun and vacation. And we just need to build that into our schedule. And I learned that from somebody else who told me that's what they did. And so in those dark days of winter in the Northeast, I go someplace south. And that's one of my strategies. The other thing that I've done, sort of a purposeful strategy, is to recognize that one of the things that really gives me meaning in life is helping other people and to help patients. And so the hard thing about burnout is when you are burned out, it's normal to become selfish, right? You're protecting yourself and to become inward. And so I try to balance that by always thinking about the things about me that are rewarding and motivating to help others. And so I remember one year I said, I'm going to block the week. Well, so I celebrate Christmas. I love that holiday season. And so it's just such a fun season of the year. I said, I'm going to block that week in my schedule, and I'm just going to see patients that really need to be seen. I'm just going to do more patient care, but it's going to be sort of on my own terms with that intentionality of really helping people who are in need. So I know another physician who, what he does is before he enters a patient room, he just takes like 10 seconds of thinking about what he wants, like why he's doing that. You know, that intentionality of how we want to care for somebody else, why we're in this field, and keeping that towards the top. And I will tell you, it's not easy to do without that intentionality of avoiding burnout, taking care of ourselves. That self-care is so important. And that reflective practice, and sort of keeping in tune with yourself. And that is a skill that needs to be built. I don't know people who know how to do that automatically without continually focusing on that. So it's a great thing medical school already gives you those challenges where you have to really build in that good self-care, eating nutritiously, maintaining your friendships and relationships, exercising, all of those things. They are hard, and they can stay hard. So you're already building strategies in med school.
Thank you for sharing. I'm sure these strategies will be very helpful for anyone, regardless of what point in training they are. So during residency, what was the biggest challenge you found, and how would you say it compares to the challenges you face now?
During residency, what was really challenging for me was the intensity of the work and the sleep deprivation. And the sleep deprivation was a huge challenge. And I was at a, at the time there were no work hours. So it was very intense. And I think needlessly so in many ways. I think it's much better, the schedules that we have now for people in training. So that was the hardest thing for me. And what kept me going were my social supports. So, my husband, so supportive, but I have to say, in my junior year of residency, I called up my sister. I said, well, actually I told my sister and my husband, I said, I've had it. I'm just going to quit. And my husband he said, well, whatever you need to do, I'm here for you, whatever. I called my little sister, and she said, what do you mean you're going to quit? You can't quit. You just spent all this time, you're not going to quit. So I think that like the motivation to kind of push through, and that support, and just having those connections, they're so important in conquering adversity that comes through training.
Do you have any advice for aspiring neurologists?
So advice for aspiring neurologists, I think thinking about why you want to go into neurology, and really, staying focused on that, kind of having that compass, and thinking about those longer term goals that you have. And sometimes it's helpful because the future is always unknown, to think about the past. What were the things about your life that brought you to where you are today? What are those things that have been motivating factors to you? Why you've already gone through so much to get to this point? Why did you do all that? Keep those in mind too. And then keep your longer term goal in mind too. And that can help these kind of day-to-day hard things, keep you on your true north.
Absolutely. What are some of the biggest challenges that you think neurologists today face?
I think that some of the hardest challenges are related to our system of healthcare. And that is definitely a source of burnout for physicians, because we want to give very best in patient care, and the systems in which we work, and the insurance, and all the things that we have to manage to do that, can be really frustrating. And so working someplace that those frustrations are minimized, that your values match the values of where you're working. And, I think it's really important. But our system of healthcare and some of the barriers that are part of it and some of the hoops that we have to jump through to deliver what we feel is the best in patient care, that could be really challenging. That could be really tough.
How do you think the field will change over the next few years or long term over the next 20 years?
So it's a great time to go into neurology because we have already cured some neurologic diseases that we couldn't cure. We have new treatments for them, but we still have a lot of diseases that are not curable and don't have treatment. And they will during your career. So you'll have that. Again, what I have found so rewarding is the field is growing, changing. You're going to constantly learn, and you're going to be able to offer new treatments. So in therapeutics and what we have to offer patients therapeutically, neurology has the highest, second only to oncology in new therapeutics. And with the understanding of human genetics and the advances in being able to treat genetic diseases, that is going to continue to accelerate because it is integrated with technology. And so whenever something is integrated with technology, you can see really steep advances in what we're doing.
That's incredible. So with this ever evolving nature of medical knowledge, how do you continue to stay updated on the latest developments and breakthroughs in the field?
Oh, I like to have students research a topic and teach me about it. Being in a teaching environment is one of the ways that attendings stay up to date on things. So with the students asking brilliant questions and researching the answer for us, and the residents who are learning from many other people and teaching us and asking us questions. And so neurologists who don't work with residents and students, they miss that. They miss the learning that comes along with that. And I go to conferences and I read journals, but a lot of that day-to-day learning is a lot easier in academics than in other settings of practice. We have the grand rounds, we have the educational conferences, we're speaking at national conferences and presenting posters, and all of that ends up being a lot more easily integrated.
So to tie into this, can you discuss any specific initiatives or projects that you are currently working on that you find particularly exciting or impactful?
I have a whole list of them. So I love, doing new things, and I love working on projects. But the latest one is really exciting to me because it involves a whole consortium of neurology educators. And so this is good for people who are watching the podcast before April of 2024, because in April 2024 at the American Academy of Neurology, we're developing 17 hours of neurology education type curriculum for the attendees there. So that's going to be over 5 days throughout the day, different really creative ways to think about how we do education research and teaching and building mentorship opportunities. So that's the latest.
It's very exciting. Looking forward to that. Now we've arrived to the last question. I think maybe the best question. What is your favorite part of the brain or the central nervous system, and why?
So I'm an epileptologist. I love the hippocampus. The hippocampus is beautiful. The structure of it, the neurons, the organization, how it looks microscopically, and then on gross anatomy, on imaging. And then it's just such an important part of the brain for learning, for memory, and for seizures. So it is the part of the brain that really comes together with all of those features. And so that is my favorite part.
All right. So thank you so much for your time today and sharing all your insights and perspectives. They've been incredibly valuable. And it's been a pleasure interviewing you. I think your passion and dedication to neurology and medicine as a whole is truly inspiring. So once again, thank you for your time and your contributions to this podcast.
Well, thank you so much, Audrey. It was such a pleasure talking to you.